Hello, my name is Kelly Strickland, and I'm an assistant clinical professor at the Auburn University School of Nursing. And I am so excited to present to you today my team's presentation, Influencing Rural Health One Episode at a Time. And we would just like to thank the Rural Nurse Organization and the International Rural Nursing Conference for allowing us to present today. So let me share my screen here. Okay, so I have one of my team members listed there, Mrs. Megan Jones. She has been with me from the very beginning of all of this, and so I wanted to give her credit, of course, where credit is due. So let me go to our objectives here. So objective 1, by the end of the presentation, you, the learner, will be able to prioritize 3 goals for your own health education podcast, which is on the analyzed level of Bloom's taxonomy. The second objective is by the end of this presentation, you will be able to compare strengths and weaknesses of this health education mechanism. So evaluate, in the words of Bloom. And then objective 3, by the end of this presentation, you will be able to plan 1 episode for a health education podcast, which is on the create level of Bloom's taxonomy. So these are our objectives. Hopefully we will meet them and you will be able to do all of these things at the end of this presentation. So what's the purpose and the aim of our project? The purpose is to create a resource that leads efforts to promote the nursing profession and increase the quality of life for all participants, including those living in rural areas. And what I've included here are some photographs of some areas that we continuously and consistently work in. So you'll see a couple of different towns that are local to us here at Auburn University in Auburn, Alabama. These are some rural areas that we are investing in, and these are also some rural areas that are listening very consistently to our podcast that we have created. So I wanted to give them a little bit of credit and show you kind of the areas that we have been investing in for quite some time now, not just with the podcast, but with some school-based interventions and some community assessment projects and some telehealth experiences. So hopefully this just puts a little bit of a visual in your mind as you listen to the rest of this presentation. So a little background. The Rural Healthy People 2020 National Survey ranks access to quality health services as its first, which is really interesting and exciting and necessary, I think. Access to quality health services is really rare in these rural areas. So there are less healthcare providers practicing in rural areas than in urban counterparts, but that's not the only reason that these rural areas are suffering in their health. As you all are, I'm sure, very aware, many individuals from rural areas suffer from financial poverty. They have less access to normal internet speeds, less access to adequate transportation, and many of them are under or uninsured. And so these are just a few of the barriers that they face on a normal everyday basis to have access to quality health care. Healthcare providers, as a result, have to turn their focus from the traditional medical model to a much more holistic upstream model of care. And disease prevention and health promotion are really, really crucial for us to have success in these areas, these rural areas. And Auburn University School of Nursing recognizes that. And we utilize podcasting to disseminate accurate health education to our listeners on a very regular basis. So what are some of our methods? Well, Podcasts have been shown to be a very easily accessible, effective resource for health education. And one might say, well, internet access is a problem in rural areas, so how is podcasting accessible? The good thing about podcasts, for those of you who are unfamiliar, are that they can be downloaded when you're in an area with good internet access, and then you can access them whenever you like. You don't have to continue to have access to strong internet to be able to access them. And so they're downloadable, which makes them accessible, and free, which is an excellent addition to the benefits of podcasting. One of the goals of our podcast, entitled Nurse Narrative, is to increase access to accurate health information for all listeners, including those who listen in rural areas. So we know that many individuals might have access to health information, but it might not be accurate. And so giving them a place where they can come on a regular basis and receive that accurate health information is very important to us and our outreach team here at Auburn. And so we really do want to increase their access to that accurate information. Topics for our episodes include and reflect the U.S. Department of Health and Human Services National Health Observances, and then also current events that are occurring both locally and nationally and globally. And so an example, in February, we started this back in the fall of 2019, so before COVID hit. But that first February in 2019, we covered heart health because it was American Heart Month. And so we had guests that were experts in cardiac care talk about cardiac care in a very understandable way, keeping health literacy in mind as we were talking to not only other nurses, but also people who just tuned in to listen to what we had to say about heart health. So we take those national health observances and we look at them on a regular basis to see kind of who we should invite as guests on the podcast. And then we also look at current events occurring, local to global. And so we have had some international guests that have come on to talk about different issues globally, but we've also had some guests from other places in the United States come and talk. And so we have not only people from our own backyard, but we have people from all over talking to our listeners about these very important topics. So there are 3 faculty members that host the podcast, and I'll show you our faces in just a moment. The guests that we ask on possess expertise in the designated health topics and current events. And so you'll be able to hear that when you listen to our episodes, and hopefully you will. And so it's exciting to see them share their expertise on a podcast episode. Health education is provided throughout each episode. And at the end of the interviews, guests are asked to give actionable steps for listeners to be able to apply the education they receive. So it's not just a place to come for health education, it's a place that they can get actionable steps so that they can then go into their communities, wherever they might be, and apply what they've learned from our episodes. And new episodes are published about once a month. We started off by publishing twice a month, but with COVID, once it hit, it became very difficult for us to use any type of equipment that we had bought for the podcast. And so we started recording via Zoom, which became a little bit complex. And so we're now starting back on a more normal basis. And we're hopefully going to get back to that 2 episodes per month. But for now, we're doing about 1 episode a month, and that has worked out well for the faculty members. All of us are actually either in or about to be in a PhD program, so you can imagine that takes up a good bit of our time. And so, but we still want to really invest in health promotion and disease prevention because we believe in it. And so, although our time is pretty occupied, we still make time for this podcast because we believe in it. And we all are very much on board. So you'll see at the left is Mrs. Megan Jones. In the middle is Mr. Chris Martin, and then on the right is myself, Miss Kelly Strickland. And this is our team. So when you decide to listen to us again, which hopefully you will, that's our face, or those are our faces. So hopefully that gives you a little bit of a visual of our team. So moving on to some definitions and some results. So the U.S. Bureau of Census defines rural communities as those with less than 2,500 residents and or population density of rural areas range from 1 to 999 individuals per square mile. So it doesn't necessarily have to be both of those things, but it does need to be one of the two to qualify as a rural area. And so using these specifications, each of the 74 cities in Alabama that we saw had listened to our episodes were examined using citydata.com and Data USA. And those two websites will give you population density and populations of cities. And that helps you determine where you're being listened to, but also, or kind of a overview of where you're being listened to, but also what qualifies as rural and what does not. And so again, we can analyze where exactly we are being listened to. And to go on a more global scale, we have found that we are on 6 of the 7 continents. So people have listened in 6 of the 7 continents, which we're really proud of. If you know anyone in Antarctica who would like to listen to us, that's the only one that we have not been listened to. And so 6 of the 7 continents have invested time listening to our podcast. 32 countries, we've had listeners from 32 countries and 699 cities. And that was as of April 2021. So those numbers have increased by now, but that was the last time that I had the ability to update this presentation, or at least the information in the presentation. So that was what the abstract that we submitted said. And so we're really proud of those numbers and excited to be able to see those continue to grow. But like I mentioned earlier, 74 of the cities that were mentioned from the 699 cities are located here in Alabama. And so we analyzed all of those 74 cities in Alabama, and indeed 16% of those Alabama cities meet rural criteria according to City Data and Data USA. And so what does this actually mean? Why does this matter? Why is it important? So let's go to implications for nursing practice. There's a couple of lessons that I have learned so far from this. And when it comes to rural health, the first lesson is that data from the podcast platform that we use, which kind of shows us where we're being listened to, how many people from each area are listening to us, how often they're listening, and which episodes they're listening to. When we look at that data, we see that rural communities are indeed listening. Like I said, 16% of those cities in Alabama specifically are rural, considered rural areas. And so we know that rural communities are listening, which is very exciting to us. The second lesson that we're learning is that there is really an underutilized resource that's free to the client or to the patient. It's downloadable, it's easily accessible, and it can be tailored to specific rural community needs. Anyone can start a podcast, and that's something that we learned very much in 2020. There were many, many new podcasts that came available. Like I said, we started ours in late 2019, or fall of 2019, but we ordered some nice podcasting equipment. We ordered great headphones. Our sound is really top notch, but anyone at all can actually start a podcast. You can just use your iPhone in the voice recording app and upload that to a podcasting platform. It's very easy. We actually are part of, like I said, we belong to a platform. We use Buzzsprout. And that's only I believe last time I checked, it was $12 a month. And they will put our podcast episodes out on Spotify, Apple Podcasts, Google Podcasts. We're on Stitcher, we're on Overcast. So all of those main podcasting platforms, you have easy access to be able to disseminate your information. And those are really mainstream podcasts. So we're able to come up, when you search Nurse Narrative, we are one of the first podcasts that comes up. And so this is really good news. For the client, they don't have to pay a dime to get this health information. And if you are a nurse in a rural area, you control the narrative. You're the one who chooses what you talk about. If you see certain disease processes that you assess over and over and over, or certain health behaviors, or certain things that you would like to discuss with your clients, you can do this. It's much easier than I anticipated. I thought it was going to be much more complex. I am not technologically savvy, and I can do this. If I can do this, you can do this. And then the third lesson that we've learned is, at a time when access to quality care is really the first priority of rural communities, podcasting is a very innovative way for nurses and other healthcare providers to distribute health education, and then hopefully by extension improve rural health. And that's what we plan on looking at in the next coming months and years, is how are these episodes actually impacting the lives of those who listen? And so I look forward to looking at that data and hopefully sharing it with you in a future conference. But so far, this is what we have learned, and we are grateful to be able to share this information with you. So thank you so much for listening. If you have any questions at all about podcasting, or about just how to kind of start from ground zero and knowing nothing about podcasting and then being able to disseminate information across the globe, please feel free to contact me. My email address is kps0010@auburn.edu, and I am happy to help you get started in your journey towards podcasting, and hopefully by extension, improving the lives in the rural areas that you are serving. And here is a list of our references. So again, thank you so much for taking your time to listen to this presentation. Thank you to the Rural Nurse Organization, to the International Rural Nursing Conference, and I look forward to watching all of you all's presentations. Thank you so much.